Hello, I'm Dr. Debbie Guillory. I have Miss Lou Veterinary Clinic in Vidalia, Louisiana. I've been in practice here for 24 years. I now practice here with my daughter, Dr. Veronica Duncan. We see just about anything that comes through the door or drives up in a trailer. We do a lot of horse work here, and as a family, we've always been a horse-oriented family, and we've always competed. We've used a lot of different products through the years to try to keep our horses healthy and do the best we could to take care of them so that they could take care of us when we took them out and competed. I became or was introduced to Equipride through a friend of mine, Jennifer Melton, who is an equine dentist, and she's also a client, and she told me about Equipride and showed me the product because my daughter had a mare we were having trouble with who had repetitive tying up episodes. The product worked great for us. We won 3 state championships in the Louisiana pole bending and went out and placed at the nationals in the High School Rodeo Association. So the product worked quite well for us. Then I started noticing different reactions and different successes with other horses. Recently, one of the things that I noticed was I had a client and a fellow barrel racer. She had a little gelding that had been doing well, and then over a period of a couple months, little horse started having little colic episodes. Nothing real big. He would lay down, look at his side a little bit, and would really worry her. She'd give us a call, and he responded really quickly. And then in conversation, I asked her, I said, Kelly, you still have Woody on Equipride? And she's like, no, I ran out and I called one day and y'all were out, and so I just didn't get him on it that day, and I was supposed to come that week when y'all got the product back in, and I just didn't make it back in. And she said, and then I kind of thought maybe I couldn't afford to feed him the Equipride. And I was like, so how many colic episodes did he have when he went off the Equipride? And she said, 3 or 4. I said, so tell me again how the product isn't affordable. And she stopped and she goes, I got your point. Woody's going back on Equipride. So when in fact the product is quite affordable because you get such a big quantity of it for not a lot of money, because having put him back on the product, he hasn't had another episode, and he had 3 or 4 within a month and a half time. We've also seen some amazing results with some foundered or laminitic horses, and I believe that it's a result of a lot of things that Equipride has, but primarily I think it grows feet, and they grow their feet out, and they're healthy feet, and I get heels on some of the little Dock bar horses that had no heel or had an underrun heel, and now you've got some heel growing, so you can actually work with that, and you've got some foot to nail the nail into. I also have seen a huge decrease in the amount of feed that I have to feed, and I honestly think it helps prevent the now real prevalent known gastric ulcer. It's just become so evident that so many horses have suffered in the past. So anything that you can do to make your horse feel better without having to give him a lot of extra medicine, because there are certainly wonderful antacids out there in all forms that work great. But if you can prevent the ulcer, besides having to treat the ulcer, and you can prevent it on a daily basis, to me that just makes great sense.